You're getting braces to get an even better smile, right? Well, you gotta be ready to own your oral health. That means knowing the right way to brush, floss, and rinse, so that by the time those braces come off, you've got a smile you're gonna wanna show off. So, why is it super important for us to take special care of our teeth while we have our braces? You see, brackets and bands can trap bits of food. If you don't remove it properly, then bacteria and plaque, which is this sticky, germy gunk, can build up on your teeth and gums. This can cause your gums to get red and puffy. Your teeth could get weak, leaving you with these white spots that stay on your teeth even after your braces are removed. And then there's the bad breath. Gross. But don't worry. With the help of the people at your dental office, Crest and Oral-B has products to help you keep your mouth clean, healthy, and fresh. And we begin with brushing. Sometimes with a manual brush, it can be hard to get all of the parts of your mouth where food can get trapped. An Oral-B power brush can help you get rid of way more plaque and reduce your chance of gum disease. The oscillating rotating technology of Oral-B power brushes removes 100% more plaque from hard-to-reach areas than a regular manual toothbrush for cleaner teeth and healthier gums. Plus, you can get a special brush head made to work with braces. And a power brush can be way easier to use than a manual toothbrush. Try it for yourself. Just hold your Oral-B power brush lightly with your fingertips. Hold it parallel to the floor against the side of your teeth. Guide the brush head slowly from tooth to tooth, following the natural curve of your teeth and gums. You don't have to press hard or scrub. Just let the brush do most of the work for you. Hold it in place on each tooth for a few seconds before moving on to the next tooth. Clean all of your teeth, one by one, and don't forget to reach all areas: the insides, outsides, the top chewing surfaces, and even the back of your mouth behind the back molars. Make sure you angle the brush head against the brackets to get them super clean, between the bracket, your gums, and under the orthodontic wires. Once you're done brushing, brush your tongue to freshen your breath and remove any extra food. Be sure to brush for at least 2 minutes twice a day. And remember to replace your brush head every 3 months for the best results. Oh, and Oral-B has this cool app that makes brushing the right way even easier. It's kind of like a game to see how well you can brush. You can download it for free, and your dental professional can program it for you. It syncs with the latest Oral-B power brush and tracks the position of your head using facial recognition. The app guides you with simple instructions while you brush and shows how well you're brushing all 6 areas of your mouth. That way, you can always be sure you've brushed every zone. Amazing, right? We all know that brushing can't do it all. We have to floss. And even though nobody likes to floss, it's super important. You see, bits of food get stuck between teeth and around the braces, and if you leave it there, plaque could build up, causing gum disease and bad breath. Luckily, Crest and Oral-B has a floss that can help. Both Oral-B Super Floss and Threader Floss make flossing with braces easy. That's because the stiff end helps you thread the floss between your brackets. Now you try it. You simply point the threader under the wire, in the space between 2 teeth. Push the floss halfway through and then grasp both ends of the floss with your fingers. Gently work the floss back and forth between each tooth a few times. When you get down to the gum line, curve the floss into a C shape following the line of the tooth, making sure you floss down below the gum line. To move on to the next tooth, pull the floss out gently to re-thread it under the next wire. Be careful not to pull on the floss too fast, or you might pull off your bracket or shred the floss on the braces. Keep doing this on every tooth, both top and bottom, remembering to do the very back of your mouth. If you floss every day, your teeth and gums will stay healthy. And if your gums bleed for the first week, don't worry. Flossing as part of a complete dental program should help heal your gums. Then the bleeding should stop. And don't forget to rinse with a mouthwash after you brush and floss. Rinsing helps remove every last bit of food and plaque that brushing and flossing leave behind. And if you have any questions, ask your dental professional. Stick with your oral care routine, and with a little help from Crest and Oral-B, you'll be on your way to embracing that killer smile you've always wanted.